Hi, everybody. This is Dr. Amanda with Body Logic, where we help people move better, feel better, and live better. Today's message is brought to you by the letter L, and L stands for laser, more specifically, our Class 4 Sumis Horizon laser system. Some of you are already familiar with this laser as it is used to treat musculoskeletal conditions. We've successfully treated for plantar fasciitis, tennis elbow, hand and wrist conditions, chronic neck and low back pain, carpal tunnel, you name it, we've been working on it. There's many more things that it can help. Today, however, we are going to talk about laser and its ability to treat peripheral neuropathy. You might be asking yourself, what is peripheral neuropathy? Simply put, peripheral neuropathy is a condition that impacts the nervous system in the periphery or outside the brain and spinal cord. Communication among the peripheral nerves is essential for the body's communication with that central nervous system. As described by the National Institute of Health, peripheral neuropathy is a disruption in nerve signaling and can be disrupted in three ways: loss of the signals that are normally sent, inappropriate signaling where they shouldn't be any, and errors that distort the message being sent. Most commonly impacted is the sensory information. When there's damage to the sensory nerves, symptoms develop such as numbness, tingling, burning, stabbing pain. For some people, they describe walking on sponges. The damage begins the furthest way from the nervous system, and hence the feet being the most common location to first experience symptoms. The leading causes of peripheral neuropathy are diabetes, chemotherapy, alcoholism, old age, and trauma. The symptoms can greatly affect a person's quality of life and can be detrimental to long-term movement and health. In fact, peripheral neuropathy is the leading cause for amputation. So why am I talking to you about this? Well, for a couple of reasons. First, as a chiropractor, I'm always looking for ways to help the body naturally, and that is the beauty of the Sumis medical laser. There's no drugs or surgery involved, just light working on its amazing and powerful spectrum to support the body and create an optimal healing environment. The clinicians and medical personnel at Sumis have created an incredible protocol that helps reduce and resolve the symptoms associated with peripheral neuropathy. Working on the red light and infrared light spectrum, the laser improves circulation, reduces pain and inflammation, and allows the body to regenerate nerves and blood vessels. The science behind it is absolutely amazing, and allows the body to heal itself, which is the cornerstone of chiropractic care. The other reason I'm talking to you about this is because I've witnessed what peripheral neuropathy can do to somebody's quality of life. Both my grandfathers have suffered from it. One of them did not take good care of himself and had uncontrolled type 2 diabetes. Unfortunately, I don't have memories of him even standing, but I do have memories of him losing a foot to amputation, then another foot, and eventually up to the knee on one leg. It took away his quality of life and resulted in living in a hospital bed until his passing. My other grandfather is thankfully still with us. However, he suffers from peripheral neuropathy due to type 1 diabetes. He has taken great care of himself over the years and is still doing well at 91 years of age. However, he can't feel his feet and has a fall risk, and that's a big concern for our elderly. When those I love are impacted by something, I want to find a way to prevent others from suffering. We found our answer. Our team was trained in Tennessee with Sumis clinicians to understand the anatomy and physiology related to peripheral neuropathy, and we have learned the protocol associated with it. Now I have a favor to ask you. Can you please spread the word? Can you please share with your loved ones that may be suffering? Do you have a neighbor that could use our help? Do you know someone that beat the hard battle with cancer but is now struggling due to the onset of peripheral neuropathy? Currently, the only mainstream treatment option is masking the symptoms with medications. Sadly, this only takes away from the body, makes us sicker, and it doesn't resolve the damage that's been done. It is my goal to treat 50 peripheral neuropathy patients this year with our amazing laser. I want to give them the quality of life back. We will be hosting informative talks about peripheral neuropathy in our office in the next few weeks. We will pass along that info once we have confirmed the dates and times. But that is not a reason to wait to share. We are currently scheduling consultations and examinations to determine whether or not peripheral neuropathy is the cause of symptoms and if laser is the appropriate treatment option. Simply call or stop by to schedule. Please spread the word. I want our community to know that there is help. Thank you, and let's get everybody moving better, feeling better, and living better.